All right, now it's time for health, and we have Dr.Favour Oyewole in the building. Now, she is a medical doctor who is passionate about physical health and mental wellness. She has worked with various NGOs for healthcare services delivery with emphasis on preventive health rather than curative health. Welcome back to Wake Up Nigeria.
Thank you very much.
Right,
good morning.
Good morning. How are you doing today?
I'm fine, thank you.
So last week we were talking about hypertension and diabetes, right? But this week we're going to be talking about something totally different. We're going to be talking about kidney stones.
Yeah.
Kidney
diseases.
Kidney diseases.
Yeah.
Okay. Okay. So now let's go into this conversation. Let's start from the very beginning, right? What would you say is should I start with causes, or how would you like to start this? Should I start with causes? What would you say is a major cause of kidney disease?
Yeah, so I think that the major causes of chronic kidney disease are different kinds. There's the acute, there's chronic kidney disease. Now, the chronic kidney disease is usually caused by scarring of the kidneys, and many things can cause that.
Okay, so before you go further, let me pull you back a little bit.
Okay.
So now let's first find out the use. Because a lot of people, I mean, you hear kidney, we know we have an organ in our body that's called kidney, right? So let's find out what is the use, what does the kidney do?
Okay.
But so then we're going to talk about what scars the kidney and how to prevent that.
Okay, so basically you have two kidneys.
Okay.
One on the right, one on the left.
It's the most sold organ now, right?
Yeah.
Just saying.
Yeah, so the kidney helps in balance of the body. So like there's fluid in the body and salt in the body. So the kidney helps to balance salt, fluid, input, output. Also, there are some hormones that the kidney produce that help in blood regulation, you know. So that's like a very good, there are major functions that the kidney perform. It removes toxins from the body also. So anything you eat that's poisonous, you don't always like have those symptoms. Like it's not everything you eat that is bad, that comes, like that shows or reflects in your body, because the kidney is doing its work. So when there's a problem with that, I mean, it's a big problem.
Okay.
Yeah.
Okay.
So
now what can cause kidney scarring, as you said, Ellen? What is kidney scarring?
yeah, so like the kidney has some cells and tissues that make up the organ. So if there's like an inflammation that causes scarring, the cells, the tissues, they won't function the way they're supposed to function.
Okay.
Just imagine like there's a wrinkling on your clothes or something like that. So it's not as before. So obviously it won't serve the function it's supposed to serve. So if it gets so bad, then it can cause end kidney damage.
Okay, so what can cause that scarring?
Yeah, so things like if there's high blood pressure that has gone on for a long time, high blood pressure, there are infections. So like some water infections can cause it.
So, yes, so speaking about water infection now, I was going to talk about, are there substances we directly take, like eat or consume, that can cause the kidney scarring?
Yeah, so typically diet would probably be the last thing that we'll talk about when it comes to kidney disease, because there's usually a genetic issue. There's obesity as a risk factor, right? Obesity is a risk factor for a lot of things, so really, it's just always better to like have that within normal body mass index. So, but things like some other things that we can ingest, like maybe like drugs, some non-steroidal drugs like ibuprofen, all these common drugs that people use for pain relievers can also like contribute to it. Then steroids. A lot of all those steroids, cream, all those things, So intake of that could cause kidney disease. Infections, HIV, hepatitis
Some
B.
people argue that bleaching. Kidding. Like,
Yes, so poisoning.
Basically anything that is poisonous to your body. So whether you ingest it or you just even apply it, it can actually
get to the kidneys.
Absorb the kidneys.
Yes, let's not forget that the kidney helps to remove toxins. So like those things have to go through the kidneys and they cause damage, and after some time it's really bad. So like mercury in bleaching cream, because that one really like helps to like whiten the skin. So people that use bleaching creams, there's mercury poisoning, sometimes lead poisoning. There's also the steroid that comes with all the soaps and creams, like hydroquinone, that cause damage to the kidneys. So any of that could cause, and we have a problem in blacks, or let's say Nigeria, with bleaching creams. Yeah.
That's actually really, really sad. Okay, so now in the situation where someone actually finds themselves in that situation where they already have kidney scarring or kidney disease. Okay, no, before I go there, let's talk about, you spoke about the different types, would I say types or different levels? Because you said there's acute kidney, and so what is the difference? Is it just one that just gets really bad, or is there
so
something
acute
else
is like usually, that one, acute kidney disease usually comes like, it's short term. That means like the course and the effects is usually short term. Okay. So that usually occurs when maybe if there's, what's it called? If there's diarrhea infection, like you eat taking something and you're losing a lot of salt and water so fast. And that's why we advise that you take ORS or oral rehydration. So that's salt, just to replace it. So like if there's like just a short-term thing and it could cause acute kidney disease. But a lot of times, the one that we can really manage and prevent a lot of times, or that goes on for a long time, is the chronic kidney disease. Do you get? Although acute kidney disease can be managed too. Okay. But when people can prevent those factors, like the things I talked about, even sickle cell could lead to kidney disease. Okay. Heart disease could lead to kidney disease. The heart and kidney, they have like a dynamics. Yeah. So if there's an impairment in any of that, could lead to kidney disease. Okay. So if people can, prevent those things, like can manage your high blood pressure, even diabetes, right? Manage your sugar. If you can, practice safe sex, this can prevent all that. So in summary, I think what you're trying to say is that anything that's going to affect your body negatively, probably that's going to affect, so it's going to literally affect the kidney as well. Yeah, because, So it's not even dietary, it's just a whole lot of different things. So any harmful thing, more. Yeah, any harmful thing. But of course, infections. You could, that if you reduce your salt intake, that could help with hypertension, high blood pressure, right? So if you can reduce salt intake, it's a cascade. Yeah. So diet plays a major role. Yeah. Okay, thank you so much, Favour. It's always a pleasure having you here. Thank you for teaching us about the kidney. Hopefully we'll have you here again next week. All right, have a good one. All right, that's it. We have to go on a quick break. It is the top of the hour. We'll be back with more. Stay with us.